Hey everyone, so we're going to be talking about our next lecture over prevention, health, and wellness, as well as later on we'll talk about more of work ergonomics. So as PTAs, we play a very important role in promoting health, wellness, and fitness, and we integrate that into rehab. So we're responsible for educating our patients, not only patients but caregivers, being able to, provide direct interventions and research, an advocate for our profession. So some different things that are going to be really important for this chapter is knowing and identifying risk factors, as well as the differences for preventative measures and services, and how that can be incorporated into a client or patient's work or within their communities to improve and influence healthier lifestyles. With aligning our profession's vision of transforming society by optimizing movement to improve the human experience, these are all the efforts that should align with that. So there's some key concepts. Make for sure that you know all of the different definitions, like for health is defined as a state of complete physical, mental, and social well-being, not just the absence of disease. And this is a positive component to wellness, and it is linked to the quality of life and well being. Health promotion is just the efforts to improve individuals, groups, or communities and to achieve awareness and take action towards prevention and wellness. Health related quality of life. This is a multi-dimensional concept, and it is for self reported measures of physical and mental health. Personal health literacy is the ability to find, understand, and use the health related information and services for decision making. Physical literacy, this is when, if they have the confidence, the motivation, the physical competence and knowledge to value and engage in lifelong physical activity. Population health, this is the outcomes of a group, of like a population, and looking at the distribution of these outcomes within that group. Public health, this is the science of protecting and improving the health of individuals and communities. There is also what's called social determinants of health. These are considered non-medical factors, but it is influenced by social policies, and this can affect both the health as well as the conditions of where people live, work, and based upon their age as well. Now, wellness is a state, of incorporating all aspects of human existence, being physical, emotional, spiritual, and social. And this is an active process to make better choices to have a more successful lifelong experience. So there's some other ones too, like well-being, fitness, and physical activity. So all these are very important to incorporate as a PTA to bridge this gap between illness and wellness and to promote a healthier lifestyle and that can influence the public health and improve and enhance the population's health and quality of life. So I skipped a couple of PowerPoint slides there because it was pretty much what I was stating for each of the definitions. So next we're going to talk about chronic diseases and how they can impact. So non-communicable chronic diseases, this is the leading cause of death globally and is responsible for 74% of global deaths in 2019. The top chronic conditions in the United States include heart disease, cancer, chronic respiratory diseases, and stroke. COVID-19 became the leading cause of death in the United States in 2021, with over 900,000 deaths nationwide and 5.8 million globally. So there is what's called a behavior-related chronic conditions, and they're linked to risky behaviors. Under that umbrella would be like tobacco use. So 14.2% of adults smoked cigarettes and 4.4% using e-cigarettes in 2019, which I'd say that probably has increased since then. Physical inactivity, so only 53% of United States adults met the aerobic activity guidelines, and only 23% met both aerobic and muscle strengthening guidelines. So that's pretty low, right? So everything that we've looked at for physical activity in the previous lectures, a lot of them say to incorporate both aerobic and strengthening, and only 23% in the United States has met that goal. Another would be poor diet and nutrition. So 60% of adults have a diet-related chronic disease. So that's huge, right? So working on proper nutrition, which is so hard and so challenging, even for those of us that know more about it, about how to read a nutritional label. It can be very challenging to make for sure that we are getting the adequate nutrition that we need. So a lot of this 60% is linked to chronic diseases. So another is excessive alcohol use. So this contributes to obesity, heart disease, diabetes, and cancer. So maybe it's educating your patients if they have all three of these things already, smoking cessation, as well as, proper diet and exercise, and making for sure that they limit alcohol use. So some different statistics about chronic conditions. So 42.4% of adults in the United States are obese, and this has increased dramatically since 2008 by 26%. Childhood obesity reached 21.1%. 76% of adults had at least one chronic condition in since 2016, which I'm sure it's even more. So what does that even mean for us? So as role of us as a PTA, it's important that with each one of our patients, we identify the risk factors and design interventions to address these behaviors in patients and clients. It's really important that, your PT also incorporates this in the evaluation, maybe based upon goals, anything to help decrease the risk factors associated. Now, because of all these risky behaviors that I just mentioned, the U.S. spent $3.8 trillion in 2019 on healthcare, and 90% was because of chronic diseases. So it's huge. Let's see. So even with the high spending of how much that the U.S. has paid for, the healthcare spending accounts is 17.7%. But prevention is only about 3% of that. So, if we can improve more preventative methods preventative methods like educating our patients and also marketing about different chronic diseases and how we can modify and adjust those little things to modify risk factors would be great. Let's see. So treatment and prevention. There is the Prevention and Public Health Fund, and this is under the Affordable Care Act, and it funds the community-based programs to reduce the risk and behaviors and improve this access to care, encourage healthy lifestyles. So, as PTAs, we can improve and facilitate behavior changes to reduce risk factors. We can collaborate with other healthcare professionals to promote active lifestyle and wellness. So maybe that's communicating with a nutritionist that the patient sees. Maybe it's with the physician or with nursing, as well as, definitely your PT. But, there's health professionals out there that are just geared towards health promoting. So we can incorporate that gap in between. Wellness is a multidimensional concept. So there's 6 different dimensions, including social, occupational, spiritual, physical, intellectual, and emotional dimensions. And if you look in your textbook, there's different domains of wellness by models. And so I want you to look over that and how you can implement that, of what that means differently between social and spiritual and intellectual, emotional. So there's different, between the 6 dimensions of health, and there's perceived wellness models. So there's different models to suggest different things. Even on, let's see, the model for a healthy living assessment wheel, looking through that of what that could impact and what that means. So there's all these different domains of health as well. And there's also a table about health and wellness knowledge and skills for the physical therapist. Obviously, you can use that too as a PTA. Definitely want you to look over that. And also the risk factors, there it is, risk factors. So identifying those make for sure you look over each one based upon, for instance, there's age, there's behavioral, physical, and environmental, um, and as well as the risk factors for coronary artery disease and osteoporosis. So it's really important that we're able to identify each one of these and how we can improve the overall health of our patients. So some things that we need to incorporate as PTAs involved with health promotion and wellness. So one of those things would be physical activity, obviously. So encouraging patients to achieve the recommended daily physical activity levels. Either maybe that might be walking 8,000 to 12,000 steps per day. This will reduce mortality rates. You would also include an individualized exercise plan to improve either their mobility, the strength, endurance, or all of it. And education is huge about the long-term benefits of staying active. Another way is going to be through nutrition and weight management, so counseling patients to use different resources like myplate.gov, following the dietary guidelines for Americans, going over what healthy habits, eating habits would look like to maintain a healthy weight. Smoking cessation, so providing information on how to quit smoking, like resources like smokefree.gov and CDC smoking cessation programs. And, definitely highlighting all the benefits of quitting smoking for to have an overall wellness. There's also, you can educate about sleep health and knowing about the adequate number of hours of sleep to have for immune function, healing, and pain modulation. There's like also evidence-based resources like the Sleep Foundation to help for support. Stress management, teaching about mindfulness, relaxation techniques, stress reduction strategies, and promoting a positive outlook to help reduce pain severity or improve function. Using the comprehensive wellness assessment, like tools like the Perceived Wellness Survey, the Model for Healthy Living Assessment Wheel, this can help evaluate the patient's wellness state and to include questions about either their health behavior and social determinants during patient history. By being a community advocate as a PTA, you connect patients with the local resources to support healthy living and advocate for policies and systems to address health disparities and enhance our community's health. Now, to improve behavior change for our patients, through education and the benefits with interventions, monitoring their goals, especially for wellness goals, providing hands-on guidance for exercise and activity modifications. So there's so much that we can do to help improve the behavior of how they perceive, and through education about how they can, decreasing smoking, improving physical activity, and how to eat correctly are all going to make a big difference as well. So as identifying risk factors, make for sure that you look through in your textbooks and know what those risk factors are. There's modifiable, non-modifiable risk factors. And also looking at the pre-participation screening and risk assessment with that. And looking through the determining readiness to change and behavioral change theories like the social cognitive theory, the health belief model, the theoretical model. So compare those different models to see, through that risk assessment, we're looking to see how, what any kind of modifiable risk factors that they could change, and that's going to improve their overall wellness. Looking and comparing to all the different behavioral change theories can really help you how you can implement that if they're ready to make that change, or what stage of are they at to make the changes of their behavior. There's also motivations that can affect the ability to change. So looking at the differences of motivation would be really good to do. Make for sure you're definitely looking over all the physical activity guidelines for each of the children and adolescents, adults, older adults, and adults with disabilities. Make sure you definitely look through all that information. And, considerations for people with disabilities. So looking through that of what kind of resources are available, what is the role as the PTA, which we've talked a lot about disabilities before, but also with exercise adheredness, and going through what mindfulness means and how you can implement that. There's also some case examples of how to implement a wellness program. So all those would be really good to include. All right, now we're getting more into the workplace and ergonomics. Now, when we talk more about prevention, especially for musculoskeletal disorders, this is like your more of your repetitive injuries with repetition, a lot of repetitive movements, maybe either from lifting heavy items, bending, reaching overhead, pushing and pulling heavy loads, working in like awkward body postures, and like I said, performing the same similar tasks repetitively. They're going to look at some different things of what it would look like for work ergonomics, specifically of how you can help, either by positioning or body mechanics to help lessen muscle fatigue, increase productivity, and reduce the number of severity work-related MDSs, which just mean musculoskeletal disorders. Or I'm sorry, MSDs. I don't know why I said MDS. MSDs. But it just in general, musculoskeletal disorders or MSDs that affects the muscles, nerves, blood vessels, ligaments, and tendons. So we'll be going through each one of those here on the next PowerPoint slides. So each one of these factors I have on the next PowerPoint slide. So the first one is like awkward postures. So, are they, is the work too low? It should be at waist level height. So are they having to repeatedly bend, reach, or twist? If it is working overhead, it's putting too much stress on different body structures. If they're having to kneel for prolonged periods of time or squatting, holding in fixed positions, as you can see, like in like this one right here. Are they having to do pinch grips for a longer period of time? So all those are going to be considered awkward postures. So you're assessing to see how they do the motions and how can we change it, pretty much. So here's just some other ones, of extended reach overhead, working too high, the pinch grip, or using a tool, bent wrists, like the repetitive motions for each one. So here's just an example of how you can, modify how they perform before. Like before it was like this, now we've elevated what they're working on, and that way they're not having to bend over as far to reach into. Some visual efforts too, you want to make for sure that the eyes are at the general level and that the cervical region is in a normal neutral position if possible, because if you have to look down for prolonged periods of time or look up high for long periods of time, that's going to make differences in your body posture. Just more repetitive work tasks too. That just means over and over again, a lot of repetitive motions. So some forceful exertion. So force is the amount of muscular effort expended to perform work. So how much force does it take to perform these activities? Because then therefore they can get fatigued really easily, and so you have to modify maybe some of these factors of what that would look like. So here's just some more pictures about forceful exertions, like how much effort, how much work does the body have to perform to do some of these tasks? How can you make them less demanding and improve these awkward postures? So you kind of have to be a little bit strategic. Pressure points. This just results from the body pressing against a harder, sharp surfaces for a prolonged period of time. And this could be susceptible for like nerve, tendon, and blood vessel damage to either the skin or underlying bones. A lot of times you'll see these more so on the sides of the fingers, palms, the wrists and forearms, elbows, and the knees. Here's just the different for how, resting the forearms or wrists against sharp edges, like for like typing, that for prolonged periods of time is going to put increased pressure. That's typical for especially like for carpal tunnel. Kneeling on a hard surface, like you'll see some of these HVAC students, they might have to like, or bend over, even air conditioning, to where they have to put in and out air conditioning. They're kneeling on hard surfaces. And tool handling, how much repetitive motions do they have with the forearm and the wrist? Vibration exposure, this is like when there's like when it's like very high intensity, like maybe tools such as sanders, grinders, chippers, routers, impact guns, drills, chainsaws, circular saws. This can expose to hand arm vibration, and if they're not usually maintained properly, then they can increase the amount of hand arm vibration, and therefore it results in like fatigue, pain, numbness, tingling, increased sensitivity to cold, decreased sensitivity to touch with the fingers, hands, and arms. If it's a whole body vibration, that results from sitting or standing on work surfaces that vibrate, maybe like vehicles, equipment, platforms. A lot of times they're more associated with like low back pain. And then there's these contributing factors, like how many repetitions are too many, what degree of awkward posture is harmful. So looking through each one of this information, there's also some easy ergonomics, a link there too that you can utilize. Here's some more examples of MSDs like carpal tunnel, tendonitis, rotator cuff injuries, epicondylitis, trigger finger, and muscle strains. There's also some resources on here that I want you to look at, and some. Um, and then there's also identification of disorders and what disorder could be, what occupational risk factors and symptoms associated. So look for each one of those on that table. With the high-risk occupations, there's a list of high-risk occupations that can develop MSDs, and there's also a resource on that too. And ergonomic improvements is what we're really about, to try to rearrange, modify, redesign, or replacing tools, equipment, workstations, packaging, parts, or products. Um, some other things is you might do a job rotation, meaning rotating employees through different jobs can help with that too, with the repetitive tasks, so make sure they're not doing the same motion over and over again. So there's a lot of differences that you can improve with not only the workstation, but maybe movement of materials and the work schedules and the work pace, and making sure they have a recovery time or rest periods, and ensuring, maintenance of workspaces and tools and equipment, and encouraging exercise, and that they're wearing the appropriate safety gear. Through these, there's an overview of controls for MSD hazards. So to reduce the chance of injury, work tasks should be designed to limit exposure to ergonomic risk factors. So there's several different things that you can improve with and modify. You can look over that information. So there is a process for protecting workers, and especially like for OSHA, they're involved in that to make for sure that that they are being protected as workers, and that the place is set up correctly to reduce injury. So like I said before, you can have breakup work with frequent short recovery breaks, and paying close attention to work how the body is working and how it's performing. Our bodies are stronger, more efficient, and less injury prone when we work in mid-range postures. So maintaining a mid-range working posture simply means sitting or standing upright and not bending the joints into extreme positions. So this can be done by trying to keep the neck, back, and arms and wrists within a range of neutral position. And the employees should be encouraged to be comfortable, and to change positions when needed, and to stretch when working. Some other things, um, you know, maybe there's like different materials, tools, and equipments, are kept in the general safety zone. That would be between the hips and shoulders and close to the body, like how we talked about lever arms before in the past, and proper body mechanics. And the other thing is between the knuckles and mid chest and close to the body when it comes to lifting tasks. Here's an improving work practices for manual lifting, carrying and pushing and pulling, and what that would look like. Here are just some basic principles of ergonomic interventions of how you can set up to keep everything easily within reach and at the proper height, and so that the joints function in neutral positions and neutral postures can be maintained, and to minimize excessive repetitive motion and reduce excessive forces, minimize the need to maintain a static hold on objects and maintain a static posture leading to fatigue, minimize the pressure points, maintain adequate clearance around workstation for safety movements, being able to move the head, spine, extremities through the range of motion frequently, and the use of adequate lighting. So some principles of good body mechanics is, you can use the B for back, so maintaining a natural curves of your back and spine, and especially through the lumbar region. Arms for A is making for sure that you keep arms close to your body as possible, holding the weight close to your body, and to keep your elbows and palms up in a neutral position to stabilize the shoulder joint. T would be for twisting, so avoid trunk twisting, and you would move your feet more often to pivot or sidestep. And just keep in mind that if your shoulders are not positioned in the same plane as your hips, your trunk is being twisted. B for base of support, so place your feet shoulder width apart and staggered one slightly in front of the other is a good position to be in. Legs, use the large leg muscles and buttocks to generally force the movement, especially with lifting, and even trying to counterweight with your body weight. So bending at the hips and knees allows your legs and butt muscles to be active. E would be evaluate. So think before you act, evaluate the load and the environment before moving it. And we've gone through the process of body mechanics before, but there's several different boxes and page numbers to look over about body mechanics in your textbooks. So make sure you look over that. Here's just some more principles. I think pretty much, shortest lever arm if possible, staying close to the patient when possible. So this is for you as a PTA of how to lift patients correctly. And use of large muscles like your lower extremities to perform heavy work. Maintain a wide base of support. Avoid any rotation movement with lifting. And attempt to maintain your center of gravity and the patient's center of gravity within the base of support. So patient education for manual handling. These are all different ways, minimize carrying, pushing, or pulling distances, trying to carry roughly equal amounts of weight in each hand. So all of these different ones, make sure you look over. And lifting guidelines, look over that as well. I mean, I feel like a lot of this stuff is pretty similar, but the speed and the rate is going to make a big difference. You've gone through some of these, but I want you to review like the deep squat lift, the half kneel lift, one leg stance lift, the power lift that you've done before, traditional versus pushing and pulling an object. There's also an ergonomic video that you can watch. We'll be using these. You don't necessarily have to print, but just make sure you have these downloaded. And I think it's like a lot of these tools. I found a lot of these tools that you can use for risk assessment, and we'll be using that during our assessments. Same thing for computer workstation assessments, so make for sure that you download this information because we're going to utilize that during lab 2. Here's the workstation recommendations that you need to familiarize yourself with because you're going to tell me each one of these things for like a workstation and how it should be recommended, as well as knowing the workstation posture. Make sure you know all of these different ones for the head, shoulder, elbows, and trunk and hip and knees. And here's just additional resources that you can use. And I think that's about it. So make sure you review all of the information that is going to be included. We're going to go through like a work hardening program that you can utilize, using those different assessment tools and how could you improve postures and decrease repetitive motion. So that concludes our lecture for today. Thank you. Have a great day.